Hello everyone, hope you all are doing very fine. So today I am going to tell you the interview preparation of the retail pharmacy. So retail pharmacists are so many, like even you can work in the any standalone pharmacy, that is individual pharmacy. Second is in the hospital pharmacy, and third one is the government pharmacist. Okay, so there are opportunity in all of the way, but mostly in the individual pharmacy there are lots of opportunities. In the hospital pharmacy there are also, but in the government sectors you can do a work in the primary health center, in the rural healthcare, or in the civil hospitals, or in the municipal corporation hospitals. So there are all opportunities are open for a diploma in pharmacy and bachelor of pharmacy. All are considered here, but the major the barrier is the interview. So what kind of the questions they will ask during the interview, so let's discuss in this video. So first question will be what is the role of the pharmacist. The pharmacist role should be first to actually dispense the medicines, then to keep the record of the medicines, to check the expiry of the medicines, to communicate with the doctors, to do a proper patient counseling, and also to train a staff which is newly hired. So second question would be how many schedules are there. So there are lots of schedules, from the schedule A to schedule Y. Okay, the schedule Y is about the clinical trials, but the major schedule we need to be considered during the pharmacy practice: schedule H, schedule H1, schedule G, and schedule X. So what are that schedule? Schedule G is the medicines which doesn't need compulsory doctor prescription, but at least need observation. Schedule H and H1 needs a prescription of the registered medical practitioner. So these medicines are maybe antibiotics, antiviral medicines are there, and Schedule X is habit forming medicines. So maybe they contains codeine and that narcotic medicines. Okay. So these are the medicines. Okay, then next is which kind of the medicines need refrigerator. Okay, so there are some ointments, they need a refrigerator, then energy drinks need a refrigerator, then injectables like an antibiotic especially, they need a refrigeration, and vaccines also needed a refrigerator. Okay, so the next question is basically this is asked in the government pharmacies. So because there are the public awareness programs like dots directly observed treatment. What is dot? It is the awareness program which aims for reducing the number of tuberculosis patients, because there are a number of tuberculosis in various rural area. So government take the initiative and take the initiative is like they monitor the patient, they check their all the tests like sputum tests, and then if they found that these patients suffered from the tuberculosis, they give the kit, they give the proper medicines, monitor them, and if any side effect consider and take action accordingly, and they monitor that patient take proper medicines so that it should be cured. What are the medicines used for the tuberculosis treatment? Isoniazid, ethambutol, pyrazinamide, rifampin. These are used in the tuberculosis. Next question: what are the 5 top used drugs for the hypertension? Okay, antihypertensive agents. So you can say first is captopril, enalapril, okay, verapamil, then atenolol and amlodipine. Okay, then they might be asked top 5 anti-diabetic medicines, that is the salts. So the first is pioglitazone, then metformin, then glimepiride, then glipizide, and then insulin. Okay, next question should be like how to minimize the expiry of the medicines. So expiry of the medicines can be minimized by reducing the excess amount of the medicines order. Okay, so to maintain the order. Okay, next to actually get medicines as and when required. Okay, so these are the things, because the medicines are expired due to heavy purchase, due to the heavy credits actually, because you get credit and many pharmacists purchase medicine because of the credit, and ultimately they get expired. So in terms of the margin, they think that you will get high margin, but ultimately if medicines are not sold, it will become an expired. Okay, so these are the things. And the next one, how many tabs are there in the software. So software has many tabs like sale, purchase, then GST tabs, profit and loss tabs is there. So any more like these are the common tabs, but more than that there are lots of number of the tabs as well available. So these are the questions actually basically asked, and more questions are like antibiotics. How many kinds of types of the antibiotics, like cephalosporin, like aminoglycosides, the penicillin. So everything these may be asked. Okay. So how many types of the doctors are they might be asked, like specialties. So first MBBS, then BDS, then MBBS DCH, which is pediatric, MBBS DGU, which is gynecologist, MBBS ortho, which is orthopedic, and there are DDV is for the derma. So there are the lots of these categories are there. Okay. So these are the questions might be asked for the interview. I hope you all got this question and prepare your answer accordingly. If any more questions we can discuss. You can also comment so that more information can be get by the other viewers as well. Okay, so that's it from this video. I hope this video will definitely become very informative to all of you for getting selected in as a retail pharmacist in government, either on non-government sector, and even hospitals as well. Okay, so if you like such kind of the videos, interview preparation, career opportunities in the pharmaceutical industry, you must subscribe our channel to get more details. Okay, so that's it from this video. Thank you. Bye bye.